question I get asked all the time is, Dr. Hirsch, should you be checking the uterine lining when you're on hormone therapy? Whew, I have a lot to say on this one, so buckle up. There's two important facts that you need to know. Number one, when you are on hormone replacement therapy, we want it to go to your hair, to your brain, to your heart, to your blood vessels, to the pelvic floor. We don't want it to go to the uterus and the ovaries. Like, we don't want bleeding, but guess what? We can't say to the hormones, go everywhere but the uterus. They are going to impact the uterus. That's what hormones are going to do. So they are therefore going to change the uterine lining. Does that mean it's inherently bad or wrong? No. And this is because of point number two. Point number two is that for women not on hormone therapy, the majority of women before, like, I don't know, 18 months ago, gynecologists used a protocol to determine who would need to have a dilation and curettage, or a DNC. The protocol was if you are postmenopausal and you had postmenopausal bleeding, again, not on HRT. These were made for women not on HRT. The next thing they should do is an ultrasound. If the ultrasound showed a uterine lining of greater than 5 millimeters, then you would go back for a DNC where they could look at all the uterine lining to be sure that you don't have uterine cancer. Uterine cancer is still quite rare, but that was point number two, is that the protocols were made for women who were not on hormone therapy, and there was decades and decades and decades of time when women weren't on hormone therapy. So you have to also understand, I guess this is point number three, that just your lining by itself is not a marker of disease. It doesn't mean anything's wrong. So if I went to the grocery store and I said, everyone who is postmenopausal, come on over and get your ultrasound measured, even if they weren't on hormone therapy, I would see 7, 10, 4, 2. Does that mean anything is wrong with them? No, because you're not supposed to check their lining unless you're having postmenopausal bleeding. That is the thing that's supposed to happen first. If we just go check the lining, it's a little bit like PET scanning the whole body. You're going to find something incidental, where now we have this information, but just because we do a DNC doesn't mean there's absolutely at all anything wrong with you. So it puts you under due stress and a procedure that you don't necessarily and most likely need. Because of fact one, that bleeding can actually be common, and two, the measuring of the lining was only meant for postmenopausal women routinely not on hormone therapy to decide after they had bleeding if they should have a DNC. Because of these 2 points, it's not recommended that we just check your uterine lining. A lot of clinicians do this, especially your OBGYNs. And it really doesn't make sense because it puts so many people under due stress, anxiety, and procedures that they simply do not need. What you should do when you're taking hormone therapy to ensure the uterus stays healthy is to be on a progesterone that matches the dose of estrogen that you're on. That is actually why I always recommend FDA-approved hormone therapy, because it has been studied for its safety in terms of uterine health. So you want to make sure you've got a good doctor who makes sure that you're on the right dose of progesterone. That is going to protect your uterus more than anything else. Just checking the lining is not a good marker for, quote, uterine health. It is a surrogate marker. I hope that makes sense. If you've got any questions, drop them in the comments below, and I'll do my best to get to each and every one of them.